And that's the way you have to be. So write a U.S. mail letter. It's about 45 cents. I'm going to send it. Send them an email. Call their offices. They all have 2 offices. They have an office in the district where they live, and they have an office in Washington, D.C. Say, hi, my name is Paul Fogelberg, and I want Congressman Paulson to know that I'm a supporter of H.R. 2505, the Pulmonary Fibrosis Research Enhancement Act. It takes 12 seconds. And the young person in that office has a piece of paper, and they write it down, and they put a hash mark next to it. And every week they tally up those hash marks of telephone calls, emails, U.S. mail letters, and they hand that to the congressman. Who knows, this week, 17 people called about this bill. And if he's not familiar with it, or she's not familiar with it, once the numbers get high enough, they go, damn, I better go read that. Because people are, in my district, are paying attention, and oh, by the way, all 435 of them are up for re-election in November. They're paying more attention right now than they were 6 months ago. Russell is passing around the letter here that we drafted for your group so that you could all sign as a group. The letter comes out from this organization, signed by those of you who are motivated to sign it. There's extra copies of the letter if you want to take one home with you and consider the legislative ask. You're welcome to that. You go to this website here, click the orange button, you're into your Congress. That's what that on the right is what the homepage of our website looks like. We're not trying to raise money. We're not giving out research grants. We're not selling T-shirts. We're selling advocacy. We're trying to turn some of these 75 pulmonary fibrosis support groups in the country into an army of advocates that'll bang their pots and pans and make enough noise that will wind up getting the bill passed. Call both of your senators. Same thing, it takes 10 or 12 seconds. All you don't have to tell them a story. They could ask you if they want a personalized story. Sometimes they do, but typically you're getting a young person on the phone and they say, why are you calling the congressman or the senator? And I'm here to support S1350 or HR 2505. That's all you need to do, and then hang up. And then next week, put it on your calendar, Tuesday at 2 o'clock, call Congress. And you do it every week. One of our friends here, Sharon, said that she's written to Representative Cantor several times, and she gets a very polite form letter response every time. You can't stop. You just have to keep doing it. The number 4 thing is probably the easiest way to get to a congressman or a senator, for those of us who don't hang out with them, is you go to what they call a town hall forum or a town hall meeting, Congress on your corner. They all have different names. Especially in an election year like this one. They're all having lots of meetings so they can stand give you, their constituents, their perspective on why they should be reelected. It's very easy to go to one of those meetings. There's no cost. You have to call their offices and find out when and where. But you show up, and at some point, the congressman's going to give his speech. The senator's going to give his speech. At some point, they're going to say, does anybody have any questions? You go, yeah, I do. What's your position on the Pulmonary Fibrosis Research Enhancement Act? Don't have one. Well, we think you should support it. Brian Baird, who's on my board of directors now, and a congressman from Washington State, said there was a woman in his district who came to 11 consecutive town hall forums because she had a bill that she wanted him to consider. And he said he finally got the message. Sat down, read the bill, said, perfectly reasonable. I can support that. Took her 11 times she showed up at town hall meeting. He had a town hall meeting every week when he went back to the district. Go ahead.
I hate to couch it this way, but thinking as a lobbyist or a political behind the scenes kind of fella. I believe Senator Jim Webb is not running, not seeking re-election. So you would still want to email him and write him and everything.
You bet. Because his vote counts the same as everybody else's until December or whatever date they adjourn in December.
Okay. Would it not be a good idea to send letters and emails to both prospective replacements?
Absolutely, yes. Tim Kaine and
What's his name?
the other one. I have like George Allen. I have like 4,000 of these guys up here.
Allen.
One of my friends says there's nothing wrong with my memory. I just don't get same-day service anymore. Absolutely, you put pressure on the people who are running for office, because, God forbid, if we don't succeed in the 112th Congress, I can guarantee you that Eric Paulson in the House, and Christopher Coons in the Senate, and Paul Fogelberg, and hundreds of more advocates around the country will be there in January to reintroduce the bill again, and again, and again, and again, until we get it. I thank Russell in particular. I've done lots of meetings in lots of places around the country. Nobody has been better organized, kinder, more thoughtful than Russell Glover. You're all very lucky to have him. I've been in touch with maybe 40 of the 75 pulmonary fibrosis support groups in the country, and this one is better organized, better run than any of them. You're the model that we use. When somebody wants to start a pulmonary fibrosis support group, we say, go to this website, look what these guys are doing, copy that. So congratulations to all of you for being members of a really classy organization. And one of my favorite saints is Edmund Burke. He hasn't been around quite a while, but he said nobody made a greater mistake than he or she who did nothing because they could only do a little. Individually, any one of us doesn't have a big voice, can't make much happen. Collectively, as a unit, we certainly can. There are, by NIH's estimate, 200,000 patients today in the United States diagnosed with pulmonary fibrosis. Almost 500,000 if you add in the people with COPD. We're going to get more action out of Congress if we become reasoned, polite, relentless, positive advocates. So it's not beating them up and telling Eric Tinker he's a bad guy. He's not a bad guy. He's just a Republican. I'm picking on Eric because I'm in Richmond, Virginia. I can pick on some of the Democrats too. That is the PF Advocates website. That's an 800 number to my office in Minneapolis. At the bottom is my PF Advocates email address and my cell phone number. If you have a question about advocacy, feel free to call. 7 days a week. We're recruiting as many advocates as we can, and we want to give you all the tools we have available.
I'm new to all this, so I'm trying to focus in. When was pulmonary fibrosis? In 1968, my father died of lung. I don't think it was in the vocabulary then, was it?
I honestly can't answer the question. I've asked that question a bunch of times. Who invented pulmonary fibrosis? At some point, there was nothing, and some group of doctors got together and said, I know, we'll call it pulmonary fibrosis.
Okay, let's skip over that. But this is a positive suggestion. There's, I think, 50 people or groups that are responsible for writing on the death certificate what they died of.
Right.
Is that even in Virginia's list of causes?
Well, yes. It was done on my husband's death certificate.
Okay.
It said
I can't answer that
idiopathic
myself.
pulmonary fibrosis.
All right, so it is a list.
So it is listed there, and so they're reporting it.
Well, if they fill out the death certificate correctly.
Well, it's pretty hard to get anyone buried without a death certificate.
Yeah. No, but whether it's filled out correctly. I mean, as I said earlier,
Well,
if I keeled over right now and the ME came rushing in here, they'd probably say, Fogelberg had a heart attack. It wouldn't say he died of pulmonary fibrosis. I didn't run out of oxygen.
They would have to know your diagnosis.
Correct.
Or they'd say pneumonia, which is a huge umbrella.
Right. So education is the first thing that we do, because that's how we're going to change the perception in the medical community.
I guess if you took it 2011 and all the death certificates in the 50 states, how many of them would list this as a cause of death? That's pretty easy to get.
It is pretty easy to get, and I just haven't done the research, so I
I don't
can't
think
answer
it
the
would
question.
come near 200,000 or 40,000. It might be 5 or 10,000.
It could be. Well, I just don't know. I can't give you an honest answer to that question.
And then the second
I
half.
could admit, but I don't know.
The second half of my observation and question, being a problem solver. 4% chance of getting this legislation, okay? And why not just say the hell with it and go private and just raise the money like they did with infantile paralysis back
Yep.
and just get us that way.
I totally understand. And I've hung around in the corporate world long enough to know I can raise money in the corporate world faster than I can get it out of Congress. But the corporations that we floated the idea with have all said, you don't even have a design for what a patient registry will look like. There are many patient registries for many diseases, literally hundreds of them. So yes, as a starting point, we copy what the Centers for Disease Control in Atlanta has already done for many other diseases. But it has to be fine-tuned for pulmonary fibrosis.
And they're the only ones that can do that. If you don't get them to do it, you'll never get any.
Well, to get the design right, we need the Pulmonary Fibrosis Advisory Board, the consortium of epidemiologists and treating physicians and pulmonary rehabilitation people and patients to sit around for as long as it takes, but certainly no more than a year, to design what the elements are. Once we have a technology design, we know what questions are going to be asked. Then we go to the corporations and say, fund us. My office in Minnetonka, Minnesota is 3/4 of a mile from United Health Group. I don't know how many of you are carrying insurance cards, but if you pull it out, there's a 8 in 10 chance that it says somewhere under United Health Group.
Not right here.
Wouldn't it be an advantage to the United Health Group